Since I can't match the shade of the existing dentition, will EZCrowns still be an aesthetic result? Yes, it will. And in fact, EZCrowns are going to be some of the most aesthetic restorations you've ever placed, and that includes strip crowns. Now, when it comes to aesthetics, there's a couple things. If you want to blend it with the natural dentition that's surrounding it, you've got to do a couple things. You know, the common sense thing is as the enamel gets thinner and thinner as we get close to the gum lines, most teeth will become a little bit more yellow. They'll have a little bit more pigmentation on that gingival third. And so what we did is we took some color and we hand apply that to the gingival third of our crowns, which makes them a little bit warmer. So instead of being one color all the way through, kind of like a pontic tooth for a denture, as our tooth goes from the incisal edge down to the gingiva, it gets a little bit more warm. And that's very natural, and it blends very nicely. So if you have a tooth that's a very light tooth, the incisal part will blend nicely. If it's a little darker, the gingival tends to blend in a little bit, so it really blends in nicely. The other thing about zirconia is zirconia tends to be very, very shiny if it's really, really highly polished. We like to highly polish the occlusal surfaces or the lingual surface of the anteriors, and the reason we do that is because studies show that a very highly polished zirconia surface actually will wear almost identically to natural enamel. So all of our crowns on the occlusal and on the lingual of our upper teeth are very, very highly polished. The problem with polishing everything, so the reason we wouldn't want to, throw a crown in a tumbler and just tumble it for a bunch of hours, the facial and the buccal surfaces would be really, really shiny. And what really, really shiny comes across as is that it looks like a pearl. It doesn't look natural. It's too reflective. So we actually take glaze and we glaze the aesthetic zones of all of our teeth to knock down that shine to make them look a lot more natural. So those two combinations, adding the gingival color as well as adding the glaze to knock down that shine and give it a normal translucent look, are really what's going to set EZCrowns apart from anything else you can see on the market. I've had a crown come back for follow-up with some discolorations. What causes this? Well, the cause is usually pretty much the same in all cases, and it's usually blood showing through the crown. Now, the key isn't what causes it, it's how to prevent it, right? So we have to know why it's having a problem so we can fix it. So there's really two main reasons that you want to address here. One is when you go ahead and prep the anterior teeth, and this is usually always a problem with the anterior. Very few people will have a posterior problem. Make sure that your assistant is filling that crown completely with cement. When you prep the anterior crowns, there are going to be a little bit of bleeding around the sulcus. And when you take that crown and seat it, if the inside of that crown is not completely filled with cement, if there's any raw zirconia on the inside, what happens is as you seat that in, the blood's going to wick up inside that raw zirconia, get inside the crown, and then over time, the blood's going to start breaking down. The iron comes out of the blood. That's where you get that dark stain from. So how do you fix it? Well, remember, after your preps are done, the crowns fit well, hand the crowns to your assistant. They are going to clean them out and fill them completely with cement. The thicker they can mix the cement, the more body it has to it. So when you put the crowns on, it'll not only help you line them up better, but it'll help to displace some of that blood. But remember, while your assistant's filling your crowns with cement, don't just sit there being idle. Take some moist gauze, hold pressure, hold really nice apical strong pressure so that when you let go, you can take the crowns, seat them on. Another thing that can happen is sometimes people try to pull them back off to reposition them. That's going to act like a vacuum that'll suck blood up underneath them as well. So once you place the crowns on, just twist them, but don't try to pull them back. And that will eliminate that problem of having gray crowns. And once you get that down, that problem that you've heard about or that you used to have a problem with isn't going to be a problem anymore. Should I be worried about the wear of these crowns on opposing dentition? There's been a couple studies that have come out of Europe. We don't see wear long-term on these teeth at all. All of the occlusal surfaces or those functioning surfaces are very, very highly polished, allowing them to function just like enamel. Got a question? Got a comment? Leave it below, or go ahead and feel free to email me. Email me at askjeff@sprigusa.com. Remember, we're going to be seeing you every 2 weeks, so thanks for stopping by, and we'll do it again soon.